some mental health problems are more common than many physical health problems. While people often know a lot about physical illness, most people have little knowledge about mental illness. Let's start discussing it. Hello, and welcome to another episode of In Just 1 Minute. As we were saying in the introduction, we are talking today about mental health. Let's jump in. So what is mental health? The Public Health Agency of Canada defines mental health as the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face. It is a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. In a nutshell, mental health influences how we think and feel about ourselves and others, and how we interpret events. It affects our capacity to learn, to communicate, and form, sustain, or end relationships. The most common mental health problems are depression and anxiety. Others, such as schizophrenia and bipolar disorder, are less common. There is a stigma associated with mental health problems. A stigma refers to negative attitudes, that is, prejudice, and negative behavior, like discrimination. This all has to do with fixed ideas. Now, the prejudice and discrimination that these people with mental health problems face, they often become internalized. They begin to believe them, so they become self-stigma. Now, not all mental health problems require professional help. However, people who do require treatment may not seek professional help for a variety of reasons, such as the lack of health professionals, an inability to recognize their mental health problems, or a lack of knowledge about what services are available to them. And in fact, some mental health problems cloud clear thinking and good decision making. A person experiencing such problems may not realize that they need help or that effective help is available. They may be in such a state of distress that they are unable to think clearly about what they should do. Okay, so let's talk about the 5 basic actions when helping somebody with mental health. First, assess the risk of suicide and/or harm. Second, listen without judgment. Third, give reassurance and information. 4, encourage the person to get appropriate professional help. And lastly, encourage other supports. When assessing the risk of suicide and/or harm, it can be real or perceived. The assess term here means evaluating the situation to decide how best to help. It does not refer to any clinical assessment used by professionals. In step 2, listen without judgment is actually listening to hear, to understand what is being said, and enable the person to talk freely and comfortably about problems without feeling that they are being judged. When given reassurance and information, make sure that you help the person feel hope and optimism and realize that they have a real medical condition and that there are effective treatments. Encourage them to access that help. When you encourage the person to get appropriate help, help them to identify the most appropriate professional. And finally, help the person find ways to help themselves through self-help strategies or by reaching out to family, friends, and other supports. Something to take into account is that mental health problems often occur in combination. For example, it's not uncommon for a person with an anxiety-related disorder to develop depression. A person who is depressed may also use alcohol or drugs. Now, how disabling are mental health problems? For instance, the disability caused by a moderate depression is similar to the disability from relapsing chronic hepatitis B or deafness. The disability from severe post-traumatic stress disorder, SPTD, is comparable to the disability from paraplegia. And finally, the disability from severe schizophrenia is comparable to the disability from quadriplegia. Please check the description for links to resources and also for help phones. There is one called Kids Help Phone, but it's actually not just for kids. It's a leading phone and online professional counseling service for young people from ages from 5 to 20 years old in all provinces and territories in Canada. It's free, it's anonymous and confidential, and it's available 24 hours, 7 days a week. So it's in English and in French and in all provinces and territories, as I have said. For immediate help, please call the toll-free number 1-800-668-6868. You can also ask online at www.kidshelpphone.ca. Thank you for watching this episode of Mental Health. A new one is coming up soon, so stay tuned. And please subscribe if you don't want to miss any episodes. Thank you.